Health is central to life. Man hold on to living as distinct from existence, based on access to quality healthcare service delivery, conducive environment, and a government that places premium on well-funded and properly equipped hospitals. What is the update on the health sector in Osun State since Governor Ademola Adeleke assumed office? What are the measures put in place by the Adeleke administration to reposition public health system to meet the desire of the people? This is the second edition of Living Spring Update. My name is Tomilola Daniel, and our focus today is on health delivery, revealing the strides attained in less than 2 years.
I say man pass man, governor pass governor. Demola, now you be our man. From now till very many years to come. Demola, now you we go. Demola, now well done. Demola, now do well.
Like other public sectors, the Adeleke administration met the public health system at an appalling low level. All the three categories of healthcare delivery system were heavily challenged. The previous administrations that ruled Osun State for 12 years had sufficient resources and windows of opportunity offered by friendly donor agencies to establish quality healthcare delivery that should be the envy of all.
It was apparent that Osun State was the human capital to drive healthcare to national and global acceptance. What was missing was the political will by the two APC governments to achieve this goal. What were the measures taken by Governor Ademola Adeleke to right the wrongs he inherited? How did he restructure the public health system to meet the needs of the people? What were the steps initiated by government since November 2022 on funding the three categories of public health in Osun State? Special Advisor on Public Health to Governor Ademola Adeleke, Dr. Akindele Adekunle, recalled the parlous health system in the state before Senator Adeleke's inauguration.
For any sensible government, responsive and responsible government, health should be a premium, should be a priority. When we came on board about 16 to 17 months ago, the total health sector in Osun State was in shambles. I wonder how a government that's supposed to prioritize the health of its people will allow them to their fate, or we leave them to their fate. You know, we have three layers of healthcare delivery system. That's how it's structured. The primary, the secondary, and the tertiary. I'll tell you for free that in the 12 years of the previous APC administration combined, no tangible, meaningful interventions was done in that sector. What they claim to have done was just superfluous, very cosmetic. And I want to describe it as the wickedness of the highest order of that previous government. A very sick populace can never be a productive populace. When we came on board, a lot of our people were quite sick. Osun State is an agrarian environment. It's an agrarian state. Most of our people are farmers. Because of the fact that they cannot access basic health provisions, certain illness and diseases that could have been taken care of, they never had the opportunity to get it done. Most of them have debilitating illnesses. Giant hydrocele, water in the testicle, cataract, they barely see to go to farms. And when we came on board, we did our need assessment and saw all those things. So what do we do? Let us take care of the health of our people. His Excellency Governor Ademola Jackson Adeleke, in his wisdom, asked us to bring out a blueprint to primarily address the health needs of our people. That's what gave birth to the medical, the modern medical and surgical outreach. And within a space of a year, thereabout, we're able to take care of about 60,000 people, about 5,000 to 6,000 surgeries, cataract extraction, herniorrhaphy, hydrocelectomy were done. That gave our people the opportunity to go back to farm. We didn't stop there. Even the health facilities, the primary health care system, the health centers, which is the closest and the first point of call to our people, that takes about 70% of our people's health needs, was grossly underfunded. The previous government, Oyetola government precisely, claimed that they rehabilitated 332 primary health care centers across the state. And they told us that they had a grant of about $20.5 million. I can tell you for free that what they did there was just cosmetic. The WHO standard, World Health Organization standard, stipulates that for you to have any standard primary care centers, you must have a functional running water, that is 24 hours, energy supply, that is 24 hours, drugs in there, that is 24 hours. When we went to the supposedly rehabilitated center, those things were never there. So we now say we cannot leave our people to suffer. Health is wealth. People have to go back to their farms. We need to take care of most of their health needs. We now say, okay, since the primary care center is the first port of call, let us focus on this. The decay is not limited to the PAC. We equally have it in the secondary and tertiary facilities. But because of the fact that the primary care center is the closest in terms of volume and proximity to our people, we have to fix it well. And in his wisdom, the governor said we should rehabilitate and upgrade. Upgrade means bringing up to the standard of the World Health Organization, which is putting out 24 hours light and water supply. We have started that. As I speak to you, out of the 332 focal centers in Osun State, we have duly completed 50 with 24 hours running water, 24 hours energy supply, and full complement of drugs. If you go in there, drugs is never a problem. We are taking that further. In a couple of weeks, a week or 2 weeks from now, we're going to embark on another 100. We are hoping and working assiduously that by the end of the year, we would have completed the 332 focal centers. From there, we now move to the secondary facilities and the tertiary facilities.
The Chief Medical Director, Professor Peter Olaitan, also explained the Imole-free surgical and medical outreach.
And this one is like the first one, is also going to include 4 phases. We're going to have general surgical cases like hernia, hydrocele, lipoma, and swelling all over the body. We're going to also have those who have eye surgery for cataract and for pterygium. We're also going to have those who need glasses, who will also be given glasses that can correct whatever refractive error they have. And the last one is those who have medical issues like hypertension, diabetics, malaria, cough, and all that. So it's going to be in those 4 phases, and work is already going on. We have started surgery and other procedures like I earlier listed. I mean, the last time we went to 10 different places and we treated a total of 22,000 people. So we are hoping that we should be able to take between 2,000 and 3,000 in each location that we go this time around.
In less than 2 years, Osun State government has taken healthcare delivery to the doorsteps of the people. The medical outreach program of the state government has spread the benefit of free surgery to 6,000 beneficiaries, in line with Governor Adeleke's commitment to make healthcare qualitative and accessible. The prime aim is to build a healthy citizenry strong enough to attend their social and economic duties. One of the findings of the committee set up by Governor Adeleke at the initial stage of his administration was the questionable expenditure of $20.5 million World Health Organization donor funding of primary health care centers in the state. Special Advisor on Public Health, Dr. Adekunle Akindele, also lamented the neglect of healthcare in the state despite donor funding during the last administration.
Ó ṣe ní láàánú pé àwọn tẹ̀ láǹfààní àti rí owó lọ́dọ̀ àwọn WHO àwa ò tiẹ̀ rí gbogbo nǹkan tá à ń ṣe ń sin owó tí ọ̀gá wa tó gbà tá a kó yọ la fi ń ṣe àyàwó kankan àwọn dẹ̀ gbowó tó pọ̀ bẹ́ẹ̀ ṣe sọ́ǹsìn bíi $20.5 million ni wọn ò dẹ̀ fi ṣe kankan gbogbo ẹ̀ wà mẹ́ ó wà ní rédíò wà ní TV wà ní social media tẹ́ bá lẹ ṣiṣẹ́ pẹ̀lú owó tá bá débẹ̀ àríná tá bá débẹ̀ àrò mi 24 hours tá bá débẹ̀ àrò ògùn bẹ́ẹ̀ ibù bẹ́ẹ̀ táwọn aláìsàn sùn gan tẹ́ bá rí ó dàbí ibi tí ilé kíní àwọn so wọn ò ṣe anything but a lè dóde ẹ̀ àwọn èèyàn wa làwọn èèyàn wa ọ̀gá rẹ̀ ti sọ pé òun máa tọ́jú wọn a dẹ̀ gbọ́dọ̀ make sure pé tó bá sick wọ́n á rí ibi lọ wọ́n á rí oògùn wọ́n á rí iná lò ń bẹ̀ wọ́n á rí gbogbo ẹ̀ lò ń bẹ̀ ẹni tí wọ́n bá tó bá gbowó lórúkọ Ọ̀ṣun lọ́wọ́ àwọn partners tó bá fi ṣe nǹkan tó wù gbogbo ẹ̀ wà gbogbo ẹ̀ document wà gbogbo ẹ̀ là ń wò ń sọ ọ̀gá wa ti gbé committee dìde tó wù gbogbo ẹ̀ tó bá ti parí iṣẹ́ wọn àwọn tó gbowó iṣẹ́ tó yẹ kán ṣe tán ṣe gbogbo ẹ̀ tó máa pè wọ́n pé kán wá ṣàlàyé mọ́ iye ṣe èrè tó bá yẹ kó kó ìjọba sápò àfojú balẹ̀ ẹjọ́.
Osun State University Teaching Hospital Osogbo came into being following the demerger of Ladoke Akintola University Teaching Hospital Ogbomosho, which was a joint ownership of Oyo and Osun States. Governor Ademola Adeleke also faced enormous challenges brought about by the 12-year neglect of the only state government tertiary hospital. Chief Niyi Owolade, a barrister and one-time commissioner for health in the state, is the substantive chairman, governing board of the teaching hospital.
The tertiary healthcare delivery is very important and is very crucial to any state government. As you are aware, the 3 tiers of healthcare delivery, you have the primary healthcare, you have the secondary healthcare, and you have the tertiary. And the teaching hospital is the one fully saddled with the responsibility of handling the tertiary healthcare delivery of Osun State. The teaching hospital, which is known as the Union Osun Teaching Hospital, is the major group that is saddled with the responsibility of handling the tertiary healthcare delivery. And when we came on board last year, we met a system that wasn't right to write home about. We all know the importance of healthcare, the healthcare sector. We know that the healthcare sector, of course, you know that popular saying that health is wealth. It's very crucial, it's very important. But at the time of our taking over, the workforce was not happy. The equipment wasn't the best. We met a dilapidated place. And immediately the governor came to our rescue. This building, the entire place that occupies the Uni Osun Teaching Hospital, is now repainted for the first time in so many years. We're talking of over 20 years, and the place has recently been painted. You know, anybody who is ill, who goes to a hospital, will not want to meet a place that is in a terrible shape, because that's also psychological. The Uni Osun healthcare system is now just rising up. Teaching hospital wa tó jẹ́ pé ibi ni ibi tí a lè pè ní olú hospital ní ìpínlẹ̀ Ọ̀ṣun. ìkọ̀kan tó wà ní tá bá yọ ti ìjọba àgbà federal government kúrò, ti state wa ibi ni àwọn tó wá pọ̀ sí, àwọn tí ò tẹ̀ yẹ kó wá bí, ẹni tó ní ibà gan ń yọjú bí, nítorí àwọn òṣìṣẹ́ wa wọ́n ń ṣiṣẹ́ takuntakun. Inú mi dẹ̀ dùn wípé àwọn òṣìṣẹ́ wọn káràsì mọ́ iṣẹ́ wọn. À ń pè kí ní kí tẹ́ bá ní ẹ retrain, ìyẹn náà wà lára ọ̀kan tá a gbọ́dọ̀ máa ṣe. Ìyẹn náà ládẹ̀ sí níjọba gan sọ pé, mo ṣe sọ ní èdè Gẹ̀ẹ́sì wípé accreditation àṣẹ̀ṣe láìpẹ́ yìí, adẹ̀ yege ní accreditation wa. Ìyẹn ni pé more training, more ẹ̀kọ́ á wà fún, àní space fún àwọn dókítà wa. Ṣe pé à ń kọ́ dókítà bí náà tún ni, adẹ̀ ń kọ́ àwọn school of nursing wa, àní bí à ń kọ́ àwọn èèyàn nọ́ọ̀sì. So ó di dandan ká máa ṣètò láti kọ́ retraining, because tó bá wà nírú iṣẹ́ tó ń ṣe ń bí, ó ṣe pàtàkì kó máa ní retraining níṣẹ́ yẹn lóòrèkóòrè. Ó ṣe pàtàkì.
Managing the health sector is complex and oftentimes overwhelming. The series of government interventions in funding, training, and capacity building of healthcare facilities in the state have, to a large extent, determined the success achieved so far. Commissioner for Health, Barrister Jola Akintola, has this to say.
Now, first of all, we have started the implementation of 100% hazard allowance, which the government approved for health workers in Osun State. Not many states can boast of that. So Osun State is one of the few states that implements 100% allowance for health workers across board. And apart from that, the entry point for nurses in Osun State is level 9, grade level 9 course, while it remains level 8 in most of the states. So that's another achievement of this present administration. Then apart from that, when we came on board, we met some unpaid outstanding salaries of workers generally, including the health workers, and the governor started paying it, and retirees from health sectors too. So these are some of the achievements of this administration in the health sector, vis-a-vis welfare of workers in the health sector. And that is why when they say health workers are on strike in most of the states, in Osun State, they don't normally join, because as soon as they come to the governor, this is what we want, these are the things we want government accedes to their request. What we met on ground when we came, especially as it relates to human resource, is nothing to write home about. For 12 years, people were retiring and they didn't employ anybody, not only in the health sector, in some other sectors too. And that has really affected the personnel. So we have paucity of personnel in the health sector. And not only that they didn't recruit, not only that they didn't employ, they didn't have the mind of employing at all, because we inherited 2023 budget from them. They didn't make any arrangement for recruitment of workers in that budget. Even when we wanted to do that, we couldn't. The governor directed us to do is to make provision for recruitment of personnel in the 2024 budget, which he approved. And to the glory of God, we have provision for that. And we have started that process. As a matter of fact, if not for this agitation for increase in minimum wage, we would have completed the exercise by now. But we are waiting for what will be the outcome of the negotiation between the federal government and workers. Workers are asking for 250,000 or more. And so when they agree, we know the number, whether we can still recruit the same number approved for us, or we may not be able to employ the same number, because we don't want to do what the outgoing government did. They didn't employ anybody. Even the workers they met on ground, they didn't pay. They were not paying their salaries as and when due. They introduced what used to be half salary, what do you normally call it? And despite that fact, the half salary they were paying were not paid regularly, and about 30 months were outstanding when we came. So we want to employ the number of workers that we can pay as and when due. So that is what is holding our hand now. Then as a law bí ti àwọn adójútòfò nípa ẹ̀ka ètò ìlera. Gómìnà wò pé àwọn òṣìṣẹ́ tó ń fẹ̀yìntì, most of them age tó ní ìdògún tó ní láti máa rí àwọn elétò ìlera nìyẹn. So wọ́n lọ enroll wọn into the health insurance scheme of the state government lọ́fẹ̀ẹ́ lófò. So tó yẹ pé wọn ò ní sanwó kankan, gbogbo àwọn retirees nígbà tá a bẹ̀rẹ̀ 23,000 ó lé díẹ̀ náà fi bẹ̀rẹ̀ dáràn pé òkè ibi tó máa parí sí nìyẹn. Later làwọn rí ń gbé everyday làwọn èèyàn retire, tó wọ́n rẹ̀ ti retire, wọn ní gómìnà tí ní tó bá retire ọkàn enroll ẹ̀, wọ́n á lọ sí ọ̀dọ̀ OIS wa, wọ́n á register wọn. But àlọ́bá gómìnà ní anybody tó bá ti retire ẹ máa register wọn. So ìyẹn jẹ́ díẹ̀ lára àwọn àṣeyọrí ìjọba tó wà níbẹ̀ ní ẹ̀ka ètò ìlera. A ní láti dúpẹ́ lọ́wọ́ gómìnà wa pàápàá jùlọ fún akitiyan wọn ní ẹ̀ka ètò ìlera, nítorí wọ́n jẹ́ káwa gan, wọ́n fún wa lẹ́nu ọ̀rọ̀. We are proud of his government, we are proud of his style. Tá bá lọ sí eléyìí tí mo sọ fún yín lẹ́ẹ̀kan yẹn, there was a time tá wà ní meeting àwọn commissioners ní throughout Nigeria tí mo láti sọ bẹ́ẹ̀ pẹ̀lú ìgbéraga pé àwọn òṣìṣẹ́fẹ̀yìntì ọ̀fẹ́ láti register wọn gangan. So many states náà ti wá copy wa táwọn náà fẹ́ ṣe irú ẹ̀. So irú ìjọba báyẹn tàbí irú gómìnà báyẹn a gbọ́dọ̀ lù wọ́n lọ́gọ ẹnu. Ọlọ́run á tún máa tẹ̀ wọ́n síwájú. Ìlera tó pé Ọlọ́run á fún wọn. Ọgbọ́n wọn, ọpọlọ wọn ò ní jọba. So adẹ tún rọ àwọn èèyàn wa nípínlẹ̀ Ọ̀ṣun pé bọ́n ṣe ń kọ́wọ́ ti ìjọba ẹlẹ́yìn kan tún kọ́wọ́ ti lẹ́yìn dáadáa. Inú mi dùn pé wọ́n ti gbé epo wò, wọ́n ti gbé ata wò, wọ́n ti gbé omi wò, wọ́n dẹ̀ rí difference tó wà níbẹ̀. Sànní Adé àbí tó gbé ó kọrin, ó ní mo kanlẹ̀kùn ayọ̀ bàbá sí fún mi, ilẹ̀kùn èṣù ó ti tì gbọ̀ngbọ̀n. Nígbà tí ilẹ̀kùn ayọ̀ ti ṣí, ẹ má jẹ́ lọ wo ilẹ̀kùn èṣù, ẹ filẹ̀. Ilẹ̀kùn ayọ̀ ní ìjọba tí gómìnà Adémọ́lá Adélékè ilẹ̀kùn èṣù níjọba àwọn aráabí ẹ má jẹ́ lọ́wọ́ bí ó ti àbí ó ti ẹ dúró ti ìjọba tó ṣílẹ̀kùn ayọ̀ fún yín ó jẹ́ kúkúrú èdè.
There is no doubt that Osun State under Governor Demola Adeleke has prioritized quality healthcare as a core objective of government policy. The agenda of government is to achieve an inclusive healthcare delivery through which citizens, irrespective of age, sex, religion, culture, and political affiliations, access quality health without stress on their pocket. Director of Primary Healthcare, Dr. Samson Oluwale Fabiyi, lauded the governor's efforts in ensuring the welfare of health workers.
Ẹ jẹ́ kí n kọ́kọ́ sọ̀kan owó tí wọ́n ti jẹ wá ní gọ́ọ̀mẹ̀ntì tó lọ gómìnà ti ń san wọ́n ti ń san tí ì ṣe pé bóyá pé kíní o wọ́n ti ń san every time wọ́n san tínú àwọn èèyàn sì dùn sí and lẹ́yìn yẹn ṣe mọ̀ pé láti ẹni tí ó tẹ́ àwọn èèyàn lọ́rùn ó gbọ́dọ̀ múra ẹni tó bá mú òṣìṣẹ́ tí ò bá fi complain ẹ gbà pé gómìnà try gbogbo àwọn activities tí wọ́n bá wa mójútó tí wọ́n make sure pé ìgbà tí ó bá fi di bí 28 27 28 29 owó olúkálùkù ti ń gbà wá sálárì rẹ̀ ṣe ìyẹn ò tó lọ́tọ̀ àwọn èèyàn tún ti mọ̀ sí báyìí bẹ́ẹ̀ ni àwọn èèyàn ti mọ̀ sí báyìí wọ́n ti mọ̀ wò pé owó wa tún ti fẹ́ dé o gómìnà tíráì tábà parọ́ lókù o.
This is our show today. Join us again next week on Living Spring Update for another insightful episode. My name is Tomilola Daniel. Bye for now.
Living Spring Update is a production of the Office of the Spokesperson to the Governor, Governor's Office, Osogbo.